Should we legalize all drugs? Today on The Curious Task, I speak with Jessica Flanigan. Welcome to The Curious Task from the Institute for Liberal Studies, where we explore economics, politics, philosophy, and other ideas from a classical liberal perspective. I'm Alex Aragona, your host, and today our guest is Jessica Flanigan. Jessica is an associate professor of leadership studies in philosophy, politics, economics, and law at the University of Richmond, where she teaches ethical decision-making in healthcare, leadership ethics, and critical thinking. Jessica's research addresses topics such as medical paternalism, economic freedom, leadership ethics, and public health ethics. Her book, Pharmaceutical Freedom: Why Patients Have a Right to Self-Medicate, was published by Oxford University Press in 2017. Jessica, welcome to The Curious Task.
Thank you for having me.
So Jessica, as we were talking before, in each episode we start with a question and go wherever the discussion takes us. So let's get right into it. I'll toss it over to you. Should we legalize all drugs?
Yes. For the most part, I'll put a tiny asterisk on it, there's a conceptual possibility that maybe we shouldn't fully open the door to unrestricted access to one drug that I think is especially dangerous, and that's potentially antibiotics. But those aren't really the drugs that most people think of when we think about legalizing all drugs.
Right.
So the ones that we're thinking about, the recreational drugs, prescription drugs, we should legalize all of that.
Maybe we should get into what you define and mean as legalization, because I think some people, there's a lot of different schemes out there and policies are put forward: decriminalization, full legalization. These are debates among politicians or policy proponents of policy. So maybe you should define exactly what you mean by legalization. Are people going to have licenses to get recreational drugs? Would there be a licensed stores that can sell these? What do you kind of envision as a framework that would be the best for drug legalization?
Right. So that's a good question, because I kind of approach thinking about political philosophy in a way where I try to stage arguments where it's like, well, if you can just come with me this far, that would be better than where we are. And so relative to the status quo, there's a range of more permissive policies with respect to drug use and availability that would all be better than the current system, which is in many places incarcerating people for using drugs, requiring them to go into compulsory treatment in some cases. So relative to where we are now, I'm pretty happy with a big range of solutions. I think that the best system would be one where there were no criminal penalties attached to the sale or purchase or use of drugs. And in addition to that, it was just treated like other kinds of recreational activities. So there are certain types of recreational activities or wellness programs that a person can sign up for that should have some kinds of constraints. And here I'm thinking about constraints related to the age of the user. So you can't ride a motorcycle until you're, 16, 18, something like that. So there could be certain restrictions on age of the user or competence of the user related to the sale, purchase, and use of drugs. But the call for legalization, I think, really is just a call for parity, which is to the extent that other people are able to do other dangerous things for recreational reasons, for wellness-based reasons, they should also be permitted to use drugs.
So as we're discussing here today and we're getting into the episode, I guess people listening should think of it as that your perspective is essentially, we can walk into a liquor store, or we can go get some cigarettes, tobacco freely. That's kind of the same idea, right? You're saying you should be able to access recreational drugs to some degree in the same way.
Oh, yeah. I mean, at the point that we allow people to use alcohol, which is has really negative social consequences and is also very harmful to the user, I think most recreational drugs will just come out of that kind of parity. But even more dangerous drugs that are more risky than alcohol even, I think the same reasons in favor of not prohibiting alcohol are also reasons in favor of not prohibiting those more dangerous drugs as well.
Would you mind getting into some of those reasons? I think that as we set up the framework for this episode, it'd be great to hear why you're a proponent of legalization in this, in this way, because I think a lot of people, as they're listening to this, they immediately think of the drug itself, right? And people will skip to something like heroin and say, okay, legalizing heroin equals everyone's going to be on the street on heroin. So some people immediately jump to the dangerous effects of some of these drugs rather than considering the benefits of legalization. So if you could explore that, I think that would be great.
Right. So it is true that certain drugs are really dangerous for the people who use them. So everybody talks about heroin. That's one of them. Also, certain drugs are just drugs that are deadly to the users. So drugs that are used in physician aid in dying, for example, are deadly drugs. So the fact that a drug has deadly consequences might make some people think that we should prohibit it outright just to save lives. But what they don't see when they advocate for a policy like that is that drug prohibition also costs lives, first of all, and it costs lives in a couple of ways. It makes drugs more dangerous because there's not as much consistency because it's in the black market. So, adulteration, low quality, mislabeling drugs, things like that. That's all more likely in a black market for drugs. It also makes it more dangerous for people to purchase drugs because black markets are associated with criminal penalties. Also, people are harmed in other cases because of a lack of access to drugs. So you might paternalistically limit access to painkillers in some contexts, thinking that you don't want drug diversion, the opioid crisis. But what that means is that other people might then be deprived painkillers when they actually are in pain and have a legitimate medical use for it. Although I don't even really like that idea of like legitimate medical use, because I think that like recreational use could be a legitimate use, but what the proponent of drug criminalization would think of as like a legitimate medical use. So you could deprive those people of having access to drugs. So it's not enough to just look at the consequences of drug use and think like, oh, well, the consequences of drug use are bad, so we should prohibit it. You should also look at the consequences of prohibition. And prohibition also costs lives and harms people. And we can see this in Portugal, where in the 1990s, Portugal had like a big drug problem. Then the Portuguese people decided to decriminalize drugs and have a more kind of public health based approach to it. And fewer people died as a result of drug consumption, like way fewer. So it reduced rates of HIV transmission. It reduced rates of overdose in Portugal by eliminating a lot of the punitive approaches. It made drug consumption a lot safer in Portugal. So that's just the consequences. But I'm not going to say that, all drugs are going to be consequentialist winners. So I can imagine drugs, the consumption of which really are on balance going to cost lives more than the lives that would be cost by prohibiting the drugs. Very plausibly, I think alcohol and cigarettes might meet this bill. Cigarettes kill lots of people prematurely. And so I don't think that if you're just looking at how many life years we're going to save, that all drugs are going to get through with a case for legalization just on those grounds. But I also don't think that public officials should try to just maximize the number of life years in a population. I think that's the wrong approach because it's very disrespectful to people. If that's what we were doing, we wouldn't let people, for example, refuse life-saving chemotherapy if they were cancer patients. We wouldn't let people engage in certain kinds of risky sports or professions like free solo climbing or commercial fishing. So even if drug prohibition did save lives and life years, I still think it would be wrong because it violates people's rights. And the reason it violates people's rights is because it's not wrong to use drugs, and it is wrong to threaten people with violence and incarceration for using drugs because it's not wrong. So people who are using drugs are not liable to be interfered with. Given that they're not liable to be interfered with, drug prohibition interferes with them. And so drug prohibition is wrong. It's a rights violation for that reason. It's disrespectful to people to treat them paternalistically in this way.
Right. I always found it interesting myself personally, these inconsistency, that is the way people think about, something like alcohol or cigarettes, as you mentioned, versus something like, I don't know, like marijuana or cocaine, like let's say, like with when it comes to alcohol and cigarettes, people don't, it's a loaded word, but I'm going to say people don't want an unregulated market for cigarettes and alcohol mostly. But at the same time, they think, okay, recreational use of these substances is okay. We can have a public health awareness campaign to discourage abuse or overuse of these substances, but more than anything, it's like a health issue. Whereas when you get to something like marijuana or other drugs like cocaine, you get to a situation where people, as you were sort of saying, look at it as a criminal issue, not a medical issue. So I find that interesting, that inconsistency, because ultimately, as you alluded to, we're just talking about what people choose to put in their bodies. That's really what we're talking about when it gets down to the brass tacks. Exactly.
And I think some of this has to do with the historical development of the drug war, at least in the United States. A lot of opposition to opioids was driven by kind of racist concerns about Asian immigrants. And then like people thinking about marijuana was like motivated by sort of racist attitudes towards Latin American people. And then there's all these stereotypes, and then also the crack cocaine disparities and how crack was treated versus cocaine. That was very motivated by a kind of racial stereotypes about Black Americans. And so when we think about a typical drug user, a typical drug seller for alcohol, cigarettes, and then other drugs, we should bear in mind that the attitudes we have today are a consequence of a history that was often informed by like prejudicial attitudes towards people. And there's been support for this recently. A couple of years ago, it came out that the Nixon administration, which ramped up the war on drugs in the United States in the 1970s, explicitly saw the war on drugs as a way of suppressing what they said were people of color and hippies, so anti-war youth during the time. And so, I'm not saying that like those are why people have those attitudes now, but I'm saying that we have this kind of cultural inheritance of thinking about certain drugs in different ways that is informed by other aspects of our past, which we would no longer endorse.
Yeah, I mean, that's a really good point. I mean, that the sort of social institution, especially in the United States, that is the criminalization of drugs. I think people need to take a more serious look at what sort of created that, for instance, war on drugs. Like you said, it wasn't necessarily people worried about the substances themselves, but more the activity that they thought was connected to those substances. Of course, the reasoning brought to the public was, okay, we got to get rid of these dangerous substances. But as you said, like with the Nixon administration example, it was, the type of people that were using these substances that were of greater concern to many of the authorities.
Right, exactly. And it's not as if like in general public policy is like based on the evidence. And so like
that's a good point.
So like I think sometimes people will kind of look at the policy and then they'll sort of like backward induct like, oh, well, it must be that these drugs are more dangerous than the drugs we allow. Like I'm sure that the public officials that are in charge are like following the data. But if you just like do like a PubMed review of like what is the evidence with respect to how we should talk about addiction or how we should treat addiction or how we should prevent people from overdosing, no one, like very few people in public health think, oh, like the solution is to incarcerate users. Right. Nobody would ever come up with this in the public health, even in the public health harm reduction circles, which are in some ways more sympathetic to paternalism than I am. No one would think like this is an evidence-based policy.
Right. And no one else would also think that, okay, well, some person in our family is an alcoholic. We better throw them in jail.
Right. Exactly. And there's this sort of like double narrative in the justifications for criminalizing drugs and prohibiting it, where people will say on one hand, like, oh, we can't let people sell drugs. We can't let people use drugs because addiction is a disease that impairs a person's volitional capacity. They'll have no choice once they're addicted to a drug but to make a bunch of bad, unhealthy choices. It'll ruin their lives. And so then they kind of push this kind of addiction as a brain disease narrative, which I'm very skeptical of. But even if you accept that narrative, that addiction is not like a free choice, what other mental health problem or health problem in general do we solve by incarcerating people? Like we would never think like, oh, clinical depression, like it's a disease or something. And so the solution is for us to have compulsory incarceration so that you can overcome this. Like incarceration and criminal penalties would never be the answer to any other health problem. So why do we think it's an answer to addiction? That said, I'm kind of skeptical of the addiction as a brain disease narrative, but.
And I was going to say, I think the evidence shows as well that when people go to jail for quote crimes related to substances, whether it's dealing or using them, ultimately once they filter through the system and come out of the system, they're actually worse off anyway, right?
Yeah.
This is the whole quote hardened criminals problem. You throw someone in jail for dealing or using marijuana, and ultimately out the other end they come either addicted to worse substances or they filter into a life of crime after that or things like that. I think the evidence is on the side of, once again, criminalizing these things. It doesn't at the end of the day punish someone if they go to jail for 10 years and they say, okay, I'm never doing that again. It just makes things worse.
Absolutely. And of course we can, this would be obvious, right? We can see that this would obviously happen because it's so traumatic for a person to be incarcerated. And so any paternalistic justification, any justification for prohibiting drugs on the basis of this is good for people's overall well-being needs to count the hit to the well-being of people who are incarcerated. And once you include that in your calculus, it's really hard to just give a paternalistic justification for this with a straight face. It's hard to say that this is going to promote well-being on balance because once we count how bad prison is for people. And I do think that like another thing to take into account is that often people who use drugs are making a free choice. It's a voluntary choice. And I think this because of a range of studies from psychology that show that drug use is sensitive to incentives. Many drug users age out of their addictive behavior. And so I think that the narrative that addiction is like a mental illness that requires even compulsory treatment or therapy, I even think that narrative is not based on sound evidence about the science of addiction. And that what we should really be thinking about is providing people with like a stronger basis of social support, economic support, such that mental health treatment that's like not self-medication with more dangerous drugs, and that's like the proper response to a drug epidemic, not even a compulsory therapeutic approach. But I'm just saying, like, even if you did have the health concerns about people using recreational drugs, you certainly wouldn't incarcerate them. But I also don't think that you should take that view of addiction.
Right. So in other words, what you're saying is that if there are social and economic structures and incentives that create a situation where people may turn to drugs and ultimately get addicted to them and have an addiction problem, that people should be more concerned about the social and economic conditions at that point rather than the substances themselves.
Exactly. Yeah. And this is informed by a lot of research from people who study the psychology of addiction, but I've been influenced by Carl Hart, has some work on this. And he finds that when people stop using drugs, often it's because they have other reasons in their life to not use drugs. And when people are using drugs, it's because that is like probably one of the better uses of $40 that they can, access.
You mentioned paternalism a few times. I wanted to get into that a bit more because it's interesting. You said in one of your articles, I believe it was the one on Cato Unbound, titled "Respect Patients' Choices to Self-Medicate." I'm paraphrasing a bit, summarizing, but ultimately you said that it's interesting that many people reject medical paternalism when it comes to something being done to someone. For instance, you said most people would reject doctors or the idea of doctors forcing a treatment on someone. For instance, if someone's dying of cancer and they don't want to go through chemotherapy, most people, I think it's safe to say, at least in Canada, United States, would view overriding their decision or trying to force them to go on chemotherapy as a bad thing. We reject paternalism this way. But when it comes to allowing someone to make choices about self-medication, people are a little bit more lenient with paternalism. So I found it interesting that you explored that in your article.
Exactly. So, so I think that in Canada and many places, if a doctor, for example, performed a life-saving surgery, but you did not consent to it, or a life-saving blood transfusion, but you had a religious objection, people would see that as a violation, even if it saved your life and even if it was good for you. And this is the doctor with informed consent. So you have the right to make potentially unhealthy or damaging refusal decisions about your body, even up to the level of it being deadly. So you could refuse life-saving treatment. On the other hand, in many jurisdictions in the United States, people don't have the access to deadly treatment, so they can't access the necessary means to end their lives. So you can make a deadly refusal choice, but you can't make a deadly access choice. And people have the right to compromise their health in all sorts of ways by refusing compulsory care. You can skip a physical, for example. You can decide not to, get a colonoscopy after the age of 45. That's your choice. So you can make all of these refusal decisions and they could be ruinous to your health. But if you want to make a risky access decision, then people see that as like, oh, that's the marketplace, or like that's part of, that's an economic choice, or that's like a consumer choice. That's not as important as a bodily choice. But I think that argument falls apart for two reasons. First, I think that if a person has a right to make a decision about their body, that right also means that they have a right not to have that unduly interfered with. So, and in virtue of their bodily right. So think of it this way. What happens if you decide to make a choice about your own body by like using marijuana, or like, let's say you want to use something like methamphetamines. That's like illegal in lots of places. So you want to use some meth. That's a good decision about your body you decide to make. And people say, oh, no, that's not like informed consent. That's more like a market choice. So then the government can regulate that. But how does the government regulate that? Oh, they like show up at the point of sale or at the point of possession, and then they threaten to incarcerate you. And like, how is that not limiting the decisions you can make about your body? Like, that's definitely a threat against your bodily rights. And so it's true that it happens in a different way. But if a physician in the clinical context said, oh yeah, it's your bodily choice to make, but if you refuse chemotherapy, I'm going to lock you up in a cage, you would think that still is a limit on your bodily choice, that it's like the third coercive threat against your body, even if they didn't like physically cut into you and like administer a drug or something like that, or perform some kind of life-saving surgery. So this is the first reason, which is like drug laws are enforced by threatening people's bodily rights in this way. And the other reason that this asymmetry is unjustified is that you can violate a person's right to make decisions about their body without ever touching them. So for a long time, the doctrine of informed consent was just medical battery. But then up until, the 1970s, doctors would just like routinely lie to patients about their diagnosis and about the content of their diseases. So, they did a survey of oncologists in the 1960s. 90% of oncologists admitted that they would routinely lie to patients about their diagnosis and about their course of care. Yeah, that was like so recent. That was like, 50 years ago or so. People are just lying to patients on the regular. And so it's a mistake to think that what it means to have the right to make a decision about your body only includes the right for you to police the boundaries of your body. You're also entitled to a certain kind of decisional environment that facilitates your autonomy to make these types of choices.
And it's interesting to me as you're going through all that. Once again, that's as you were explaining, it's another inconsistency in the way people think, right? Like once again, you have a situation where if someone, as you said, was going to perform a surgery on you without your consent, or was going to do a blood transfusion, you could say, whether it's religious reasons or other reasons, you could say, no, it's my body. You don't have a right to do that, even if it would save my life. And here's a situation too where even if people argued against them and said, hey, like if you died, your children wouldn't have a father or mother anymore, they could give all the reasons they want, that the effects and all the effects that would be bad, but ultimately people say, no, we can't be paternalistic to the point where we force people to ultimately accept things done to their body. But on the other hand, if someone again wants to ingest a substance, we say, we flip, a lot of people flip it to the other side, right? They say, well, what happens if you're addicted to heroin and then you die, then your kids won't have a parent, and then it goes the other way, and people accept that logic just because we switch basically just like an X factor and an X plus Y equation ultimately, not because there's any like logic to having both those things inconsistently reconciled with each other.
Yeah, and I hear this a lot when you talk about drug legalization. People say, well, if people were allowed to use drugs, they'd be like terrible family members, they'd be awful employees. Maybe that's the case. But then if you think that a person's interest in having like a good husband and father around, or a great employee, is so strong that it would justify limiting people's bodily rights, incarcerating people, threatening them with legal penalties, then why don't you just make it a criminal offense to be a bad employer, make it a criminal offense to be a bad boyfriend or whatever? But we would never do that. And so there are many ways for you to be like a dirtbag boyfriend that doesn't do anything or contribute anything to the household. One of them maybe is that you like smoke pot all the time and you are like, doing other stuff. But also that could be your personality, or you could be watching a lot of TV or be on your phone all the time. And we don't think like that a person's interest in having like a contributing family member or employee is sufficient to justify prohibiting all of that other conduct, or, we wouldn't want to prohibit people from being inattentive family members and employees directly. So like, what is it about the drugs that makes it that all of a sudden this interest rises to the level of state intervention, whereas all of the other contexts where the behavior happens, we would think would be within the purview of individual choice.
Right. Even if we found it reprehensible, like you said, of being a dirtbag boyfriend, as you said, like we don't say, okay, the state should intervene. I'm sort of laughing to myself as I picture a world where the police show up at your door and give you a $500 fine for being a bad boyfriend. That'd be pretty funny.
Right. Like you got to buy her flowers and take her out.
Yeah, exactly. Just file a monthly report and tell us what you've been doing to be a good boyfriend. Yeah, exactly. No, and I find it interesting, especially when Canada was moving towards legalizing marijuana, a lot of people started saying things like, well, what about crane operators? Are people going to come to work high and operate cranes? And I said, well, we once again, we have alcohol you can go get down the street, and nobody accepts the idea that a crane operator can be drunk and operate a crane. So I don't know why people have sort of, once again, these inconsistent thoughts. It's like, just because we have substance that's becoming legal, marijuana in Canada, doesn't mean that it becomes acceptable for you to operate a vehicle high or go to work, not sober. So that's very interesting.
No, that's a good case, because like the thing you object to is being a dangerous driver or crane operator. But you could get there in so many ways. You could be tired, for example.
Right.
And so if the danger is the justification for the prohibition, prohibit the dangerous conduct. So like prohibit reckless driving or reckless crane operating or whatever. And if you think that would be, not something that we have a legitimate interest in prohibiting, then don't prohibit it, but don't prohibit some unrelated thing just because you have an interest in this separate conduct.
Right, yeah. And then we also get to the situation, too, that an employer would have no incentive to keep someone that's doing that around, right? I think a lot of people think of only one side of the equation. It's everyone's going to come to work high. It's like, okay, well, and everyone's going to get fired, I guess. It's one of those things where it once again, we don't just throw economic rules and the way people work socially out the window because something's legal.
Right. Exactly. Yeah. Just because something's legal doesn't mean that you should do it also, is another thing that gets lost in this. And so like, there's a big role for like telling people, like as I said, like almost all drugs I think should be legal. Does that mean that I think that people should be using all these drugs? No, not for most people. A lot of times it's like a bad choice. There's other stuff that you could be doing that's like more productive and rewarding. So if you're like asking me for advice, I would advise you like to not use meth because it's going to like ruin your day and mess up your teeth. But then if you're asking me, should you go to jail for using meth? No. Right. Just because something's not a good life choice doesn't mean that you should be prohibited from doing it.
Right. Yeah. That's another aspect of the conversation too. I think is sort of underneath everything we're saying, but it's also a good idea to state it, completely blatantly is that because something's legal doesn't necessarily mean it's okay. Like, it's not bad things are always illegal and good things are legal. Sometimes you leave it down to individual choice, even if it's bad or good.
Exactly.
All right. Well, we actually are at the time to take a break real quick. So we'll be right back. We're talking with Jessica Flanigan on The Curious Task. The Curious Task is a podcast from the Institute for Liberal Studies. Feel free to send us questions and feedback to curioustask@liberalstudies.ca. A special thanks to our supporters on Patreon, including Peter Jaworski, Ken Dubian, and Vincent Geloso. Remember to like us on Facebook, follow us on Twitter @CuriousTaskILS, and rate us on Apple Podcasts or wherever else you're listening to The Curious Task. Welcome back, everyone. We're speaking with Jessica Flanigan here on The Curious Task. Jessica, during the break, we were chatting a bit, and you were saying that a lot of conversation, and specifically our conversation as well, fell into this sort of trap. When it comes to drug legalization, you often talk about, the substances people would use for, quote, personal enjoyment. So you think of something like marijuana or cocaine. I mean, marijuana has medical uses, but putting that aside, you said there's also another aspect of the conversation we should bring in as well, which is the pharmaceutical industry. Maybe you can get into that.
Sure. So, in Pharmaceutical Freedom, I talk about a couple of policies that I think also limit people's rights to use drugs unduly. That don't relate to recreational use or the right to die, but are more just about the ordinary experiences of patients. So most developed countries have pre-market approval, which means that an organization like a government agency like the FDA or Health Canada, they have a list of drugs that are approved for use. And if a drug isn't approved for use, then it's prohibited for people to be prescribed. And then they also have prescription requirements. And so for a range of drugs, if you want to use that drug, you have to get a permission slip from a physician to use the drug. And then they have marketing restrictions. So most countries will prohibit drug companies from marketing these prescription grade pharmaceuticals directly to consumers. In the United States, you're allowed to market directly to consumers, but only for a limited range of uses. I think all of these policies limit people's right to make decisions about what to do with their own bodies, to make decisions about their health, in a very similar way to the way that recreational drug prohibition does. They also cost lives, so they're paternalistic and they're dangerous to patients, just like recreational drug prohibition.
Yeah, and I think actually a really good example of this is birth control. And one reason I'm reminded of that is I had a friend who actually wrote an article recently, and basically what he said in there, in his point of view, he was basically tearing down the idea that you have to go to a doctor for a prescription for birth control. And he said, at the very least, we can move this to like more of a pharmacist thing, right? If people are worried about people being uneducated about and how to use it, like you could at least just go to the pharmacy, chat with someone, get a 5-minute discussion going, just purchase the darn thing. You don't have to, once again, go to a doctor to effectively get permission, once again, to use basically a bunch of pharmaceuticals.
Yes, birth control is a great example. So they've done studies of when they've given patient profiles of, like, to the patients themselves. So you ask women, do you think you're a good candidate for birth control, given like your health conditions, and this like little paragraph about the risks and benefits. And then they asked physicians to make the same judgment about the same patient profile. And when people were making their own judgments about whether they were a good candidate for birth control, they were actually more risk averse and more reluctant to use birth control than the physicians were. And so patients were playing it even more safe than doctors. What we see is that there's a sort of unintended consequence of the prescription system is that people might, in some cases, make more risky drug choices because they were given a permission slip or an authorization from a doctor. And so that's birth control is one case where it's kind of like that. In the United States, Plan B is available over the counter to people. So for birth control failure, you can take this drug Plan B. That's available over the counter, but Plan A, birth control, is not. So we have this system where women are required to go see a physician. And part of the justification for it is that they think that women should go to the physician to get a birth control prescription because then it enables them to screen for cervical cancer at the same time, which is totally unjustifiable. Like, you wouldn't limit somebody's access to a market in one good because you want to get them screened for some totally separate condition in any other context. Right. But you would say, like, if you want to like buy a Diet Coke, then you need to like go to the eye doctor first. But just like these two things are like unrelated, but here we are.
That's a really good point. And I think it's very interesting you mentioned as well sort of the incentive people have to educate themselves on what they're going to ultimately be ingesting, right? Like you said, when someone gets a permission slip effectively from their doctor, they might go, okay, well, the doctor recommended it. This is what I need. And it might remove that incentive to educate yourself on what you're purchasing. Once again, as you said earlier in our conversation, we're not saying this is going to apply in all cases, but I can imagine certainly that if birth control was an over-the-counter thing, you could just go in and purchase it from a pharmacy, that it increases the incentive for people to start reading about what it's going to do, what some of the side effects are, and make a choice for themselves rather than relying on a gatekeeper to make that decision for them.
Exactly. And it might also lead to more effective self-medication because it'll be more available. So now imagine that you have to like see a physician, pay your copay, make an appointment, go through all of this bureaucracy just to access birth control. That might mean that fewer people have effective access to the birth control. Whereas if it were available at your local pharmacy behind the counter, you just ask someone for it, they give it to you. Then, or even like in a vending machine, I think would be fine. Then people are less likely to have lapses in birth control coverage and then experience birth control failure because of that. And there's some evidence that this is true both in the birth control context, but there is other studies of medicine for respiratory illnesses that people had more effective access to it if they didn't have to go find a doctor when they were sick. They could just access what were previously prescription grade cold and flu medicines over the counter. That led to fewer hospitalizations because people had more effective access. So for a range of drug classes, limiting prescription requirements might lead to more effective or safer use. But even if it didn't lead to more effective and safe use, I think eliminating prescription requirements would just recognize that the patient's the person who has the authority to make these choices. And as you mentioned, potentially give people incentives to educate themselves and reduce the kind of learned helplessness we see right now in medicine.
And on that note, I'd like to I made a note to myself to sort of try and flip the conversation at one point here. So I want to do it now. So I think it's fair to say, and of course, correct me if I'm wrong, I definitely don't want to put words in your mouth, but it's fair to say, I think that what you're essentially saying is that the default assumption should be legalization of drugs. Like that we sort of start with that. That suggests to me that there might be, the door might be open a crack there to basically say, okay, there are some strong cases to be made when paternalism might actually be a good thing. In other words, if all drugs were legalized by default, let's say, what case would you imagine would be strong enough to say, okay, no, this one right here should be, at the extreme criminalized, or at the other end, at least regulated, still be over the counter? I think you mentioned antibiotics in the first half of the episode, but I was wondering if you're going there with that.
Yes. So I do think that in principle, well, but maybe not in practice, some limits on antibiotic use might be justifiable. But the reason is not paternalism. The reason is that antibiotic resistance is a kind of a public health threat that's like a bad externality that would be from people's antibiotic overuse. So if antibiotic overuse increased the probability of the development of antibiotic resistance, then there could be a justification for some kind of public health intervention. So when it comes to public health policy, I think that public health policy more generally should focus on things that reduce the negative externalities of people's reckless conduct. So they reduce like contagious transmission through sanitation policies, potentially some cases of compulsory vaccination, so like the polio vaccine. And I think that the justification for limiting access to antibiotics could be sustained on those types of grounds, which is that there's such negative, broader externalities of that use. So it's a harm to others justification. It's not like, using antibiotics is going to be harmful to the user, because I think that people have rights to put their own bodies at risk. But it's that it'll harm other people too. You'll mess it up for everybody else if we have too much antibiotic overuse. That said, I don't think that we're necessarily there yet. And so I think there should still be a high bar for having these prohibited policies, even for antibiotics.
So when we talk about the concept of harm, you're talking about it in sort of, in this sense, a narrow sense, where we're ultimately talking about like the harm to, quote, public health, because it strikes me as interesting that in the previous part of the conversation, you and I may view someone being addicted to, let's say, heroin and having a family, that obviously causes some form of harm to that family or those kids or whatever. I certainly wouldn't say you're not saying that you don't care about that kind of harm, but would that be, in the grand scheme of this conversation, sort of a softer harm compared to what would be a harm to public health? Like, do you view that as public health as meeting that bar?
No, I don't mean to suggest that. When I'm using the word harm, I was just using it in a kind of moralized, rights-based sense. Okay. So I don't think that it's a helpful way to think of harm as like something as harmful just in case if it makes people's lives worse off. Because of course, a lot of things make people's lives worse off. So omissions, like I could have gotten you a birthday present, but I didn't. My omission made your life worse, but it didn't wrong you in any sense. So I think of harms as most usefully understood in terms of like, did you violate an entitlement somebody had? And so if you're like a bad boyfriend or a bad parent, you can violate a person's entitlement. But in the ordinary cases, just like being a kind of like neglectful person, as long as you're not an abusive person, as long as it doesn't rise to the level of abuse, it doesn't violate anyone's rights. And so it's not an apt subject of criminalization. On the other hand, contagious transmission of disease could qualify as a rights violation in the same way that other really risky behavior that puts other people's lives at risk might. So imagine that I'm in America and I'm celebrating my Second Amendment rights. And so I got on my front porch and I for reasons of conscience, I shoot a shotgun in the air. And it subjects the people in my neighborhood to some risk that they're going to be injured by my celebratory gunfire. I think that me putting people at risk in that way could violate rights that they have to their bodily safety. Now imagine that I'm like a sick person and I ride a bus and I have like measles or something and I'm sneezing all over the place. Similarly, that could be, that could violate a person's bodily rights in this way.
Right. And so I'm glad you clarified that, because in the case of the shooting the shotgun in the air kind of conversation, you're not addressing there whether or not someone has a right to have a gun, because obviously in this case, sure, whatever, they can have a gun. It's the fact that they're doing something dangerous with it. It's the problem.
Exactly.
So same thing with the harm to, let's say, if you're a parent addicted to heroin and your young children are exposed to that kind of environment and lifestyle. Once again, the problem there is that you're exposing them to that kind of lifestyle and that kind of environment, not necessarily a fact that you chose to do heroin.
That's exactly right. So the thing that should be the subject of criminalization there, if it were apt to have a kind of state intervention or a regulation, would be like parental neglect or parental abuse, not using the heroin. Like the heroin's not the problem. The problem's the neglectful parenting.
Right. That makes sense.
Because I'm sure that some people are heroin users and they're great parents. totally conceivable to me that a person could be a regular drug user and still be a functioning parent. And so.
Right. And I actually know of examples like that, to be honest. Like I'm like in Canada, like I grew up knowing a lot of friends who had parents that it was like marijuana was sort of just something else that you could use recreationally, right? There was alcohol in the house, there was marijuana, there was maybe tobacco as well, and some of these kids turned out great. Some of these kids didn't. And I guess when I really think about it, it had nothing to do with the marijuana.
Yeah. Or a lot of parents, who are in recovery are on like methadone maintenance. And I think that that's a fine, that doesn't necessarily compromise your ability to be an effective parent or partner. And it's instrumental to their recovery. So drug use is not incompatible with being like a good partner, worker, parent person. Being a drug user doesn't in any way count as like a pro tanto strike against a person's fitness to be a parent or partner.
Right. I think I remember, and we're going to search for a link to this and see if it does exist or I just made up in my head. But I swear I remember this CBC article that was published, and the angle of the article was essentially about how, similar to this conversation, drug use and addiction should be treated more as a medical thing, not a criminal thing. I think it actually featured someone who was just a functioning heroin addict. They had a job, they were respected by their peers. That's what but at night they had this addiction, and they just, they used heroin at night, but then they were able to control it to some degree. And then the ultimate point of this article is their pathway to recovery also involved juggling, on the one hand, having a job and a sustainable life, but on the other hand, dealing with this drug addiction. So as you said, it's not completely incompatible that, someone could be a good person and also use drugs or deal with an addiction. Like, and if we view it more in a medical way rather than a criminal way, you're probably going to put more people on the path to some sort of recovery, once again, rather than a life of crime or just some sort of cyclical problem.
Yeah. And that's the thing that I think is very destructive about like some ways that people talk about addiction, is that they think that overcoming addiction means being entirely drug-free and not using any kinds of, antidepressants or, methadone, Suboxone, anything like that. And I think that's a really damaging narrative, that it kind of props up this unjustified sort of purity narrative. The goal of addiction recovery, I think, should be for people to live healthier, more functional lives where they can like meet their goals. And like, I think that sometimes medication assisted recovery is the right choice for people. And it doesn't do addicts any favors to make it seem as if drug use is just a strike against a person, that they have to be fully clean. I think that kind of rhetoric around addiction does more harm than good.
Right. And when you really think about it, what do people say about what they would say is a drug addict, right? They don't say, oh, look at those drug addicts, they're doing drugs, full stop. They say, oh, they don't have a job, they don't have this, that.
Exactly.
So, presumably, if someone's really against drugs for those reasons, if we had someone doing drugs but also got themselves a job and in that way clean themselves up, not the drug way, then they should be more okay with that.
Yeah, that's right.
Switching gears a bit to regulatory government bodies, you talked about how essentially what I grabbed from your article, this is back to the respect patients' choices to self-medicate on Cato Unbound. You said that essentially what the FDA, for instance, does in the United States is weigh the pros and cons of a certain drug. That it's not just limited to them saying whether it's safe or not. It's, once again, sort of seeing on net what the effect would be of a certain drug. And you basically came right out, from what I understand in the article, and said, well, that's not what they should be doing anyway. These are normative judgments that people should be making.
Exactly. So take an example of like an investigational drug. So like a experimental vaccine for brain cancer or something. And imagine that this drug has some chance of extending a cancer patient's life by up to a year, but it also has some chance of permanently disabling them for their remaining life or killing them as soon as they get it. And then the FDA sees this experimental cancer vaccine and they think, well, is this drug acceptably risky? So what are the things that they're looking at? They're looking at clinical trial data, they're looking at animal studies, they're looking at a bunch of science. But there's no science that tells you if something's acceptably risky. Like, that's not something they teach you in biology grad school or ed school. That's not a judgment that these experts are well placed to make. Whether or not that's an acceptably risky treatment depends on the values of the patient. And so one patient might think, no, I want to be able to take that investigational vaccine. I understand that there's not a lot of evidence about it, but I'm just willing to take a chance to have the possibility of seeing my grandchildren be born. And another patient might think, no, I just want to play it safe because I want to have as many good days as I possibly can. And I'm not willing to take a chance of, a shorter life for the possibility of a longer life. These are value judgments that are going to depend on the patient's circumstances. And everybody's different. But when FDA makes a policy, they make it for everybody. So everybody has to live with regulators' judgments of whether something is acceptably risky. And their judgments of whether something is acceptably risky is based on something that they have no way of knowing, which is whether it's a good deal for the patients themselves. That's not something science can tell you. That's not something a clinical trial can show. They're making normative judgments for a bunch of people who are different. And the answer as to whether it is acceptable for them is going to depend on the person.
Right. And I think the incentive structure for government regulatory bodies is a little off too, right? Like, and what I mean by that is in the following sense. If they approve a certain drug, let's say, and then it goes on the market and kills one person, that's their worst nightmare, right? But if they don't approve a certain drug that could have saved like 10,000 people, number one, no one would really have known if that would have been the effect or not. And once again, number two, that the FDA would view that as their job. Okay, well, we weren't sure if it was risky or not, just keep it off the market, whatever. So in that way, I may be so bold to say that, they could be, in their view, there's, saving people from risk. In reality, they might actually be creating a situation where people could have otherwise be living rather than dead.
Exactly. No, nobody sees the people who are killed by regulation because it looks like they died of their diseases.
Right.
So no one sees somebody that dies of, ALS or certain kinds of cancers and say, oh, they were killed by the FDA because FDA took too long to approve this drug, or FDA policies were so burdensome that nobody was trying to develop drugs within this disease class. So it just looks like they died of their diseases. But now when FDA approves a drug, say that they're like, oh, we approved this new drug. Hooray for us. It's going to save 10,000 lives per year. And it only took us 5 years to approve it. We did a fast track. What I hear there is that FDA killed 50,000 people.
Right.
Because if the drug existed and it could have saved 10,000 people per year and you held it up for 5 years waiting for it to be approved, that would have been like a huge loss of life just caused by regulation. But no, it doesn't look like that. And so all of their incentives are lined up in the wrong direction. And indeed, their professional mandate comes from that, because why do we have these regulatory bodies? Because of drug disasters in the past, like elixir sulfitamide and thalidomide babies. So people see these vivid drug disasters, and then they cede more power to these regulatory organizations to police drug use. And so now the regulators' incentives are all stacked up to just avoid these drug disasters because that's their mandate. It's like their purpose is to avoid drug disasters. But in trying to avoid drug disasters, we've welcomed in a regulatory disaster.
As you said before, it ultimately, in your view, isn't their job to be assessing risk. And I think people sometimes forget how, the incentive structures of people who are dying from a disease are a lot different than, for instance, my incentive structure would be right now. That is to say, if you came to me today and said, hey, Alex, you should try this drug. On the one hand, it might, I don't know, be a cool trip. On the other hand, there's a 50% chance of it actually just killing you. 50% of people would take it. And I'd say, well, no thanks.
Yeah.
On the other hand, then you have people that are dying of some sort of disease and they say, look, we can try this experimental drug. And there's actually like a 40% chance it might have deadly consequences. I've known a few people in situations like that, and they're like, look, I'm already dying. I'm willing to try anything. So once again, as you were saying, It's not a regulatory body's job to be making these sort of personal value judgments.
Exactly.
Now, this is a common objection in places like Canada, so I want to bring it up today. So Canada has a public health system, mostly, sparing some nuances. Is there a stronger argument for a more regulated, market for drugs in a place like Canada? Often people would say, well, fine, all these arguments that you and Jessica talked about today are great, but we have a public healthcare system. And if we start legalizing drugs or letting people do whatever they want when it comes to substances, we're going to overburden the medical system, for instance. Is there a stronger case to be made, once again, for regulating drugs in these kinds of circumstances?
Good. So the thought is, when you socialize the cost of medicine, people's unhealthy behavior is therefore harmful to their fellow citizens who are going to have to pick up the tab for it later. And of course, this is true of a bunch of unhealthy behavior, not getting enough sleep, poor diet, but maybe you think, well, we're going to be paying for it. And so given that we're paying for a person's healthcare, that gives your fellow citizens an entitlement to decide what you can do with your body because they're going to be responsible for the care and keeping of it in some ways. So why do you have a public health system? There's a couple of potential justifications. One thing you might think is that providing healthcare to everybody, having a public healthcare system, is just like a nice thing that you do. It's like a gift to your citizens. It's like everybody passes the hat around for like, the gift for the lady that works in your office. And then you're just like, here's like this nice gift that we've all like decided to contribute to. And then if it's just like a gift and you don't want to give that gift of public health care to people who use drugs, don't do it. If it's just pure beneficence and it's elective and you have no moral duty to be providing people with health care, then that's your choice. But then if you do give somebody this gift, if you do act out of beneficence, you don't really have an entitlement to complain about how they use it. So we all pass the hat around and we're like, let's buy a baby shower gift for, this lady who works in our office. And then she uses the baby shower gift to like get her nails done instead of buy something for the baby. You guys would be like kind of assholes if you were then to be like, oh, I can't believe it. It's like, it's just a gift. It's pure beneficence. But I don't think that that's how people generally think about public health care. I think people will say healthcare is a right. You have a right to have healthcare and it's an enforceable right. And that's why we can tax everybody else and force them to provide it. Okay. Then if somebody has an enforceable right to healthcare, they don't forfeit that right. I don't think they don't forfeit that right by using drugs or putting their health at risk because it's an entitlement that they're owed. So if you owe me $50 and then I say like, oh, like I really need the $50. I want to like I want to go to an amusement park. Like you really have to give it to me. I want to do something stupid with $50. I have a bunch of bad reasons that I really need it. Doesn't matter. Like my reasons for needing what you owe me is irrelevant to my entitlement to it. So if I have an entitlement to healthcare, my reasons that I need the healthcare are just totally irrelevant to the fact of the entitlement, just like in the case where you owe me the money. But maybe you think people have a right to it, but they can forfeit that right in some way. They can waive it. So maybe it's more like something like, you owe me $50, but only contingent on me behaving in a certain way. Like you'll only owe me $50 if I like continue to like mow your lawn every week or something like that. But if I stop doing these things that you want me to do, I waived my right of $50. Great. Tell the drug users that. So say, we'll provide you with public health care unless you do meth. But if you do meth, we're going to put like a little stamp on your license that says like, don't pick this person up off the side of the road and like take them to the emergency room because they forfeited their right to it. Now you might think that would be monstrous. How could we not provide medical services to these people? I agree. It's kind of messed up if you say you're going to provide it to everybody except for these people you don't like. But then that's because you might think that they have a non-waivable right to it, in which case you have to give it to them regardless of their choices. So whatever the justification is for a public healthcare system, beneficence, right that they can't waive or right that they can waive, none of those justifications will make a person who's a drug user liable to be interfered with on the grounds that the public healthcare system's later going to have to pay for them.
Like in other words, just because someone might become a quote burden to the system, that in and of itself isn't a strong enough case to basically say, okay, therefore we're going to prevent you from doing drugs. And if you do that, we're throwing you in a cage, as you said before. You can't go from A to B in that fashion in this argument.
Yeah. If you don't want them to be a burden to the system, don't give them healthcare. If you feel like you're obligated to give them healthcare, then it doesn't matter what their reasons are that they need healthcare.
Right. And there's many ways beyond drugs that people could be a burden to the system. So then you get into a whole different mess as well.
Yeah.
Our time is winding down here, but I didn't want to leave the discussion today without getting back to something we chatted quickly about during the break. In the context of the war on drugs, which ultimately you would view, especially in the United States, as an unjust war, you were talking about that ultimately people who were victims of this are entitled to some form of reparations from the government or some form of restitution. I was wondering if you could get a bit into that before we left the conversation here today.
Oh, yeah. Thank you for asking. So this is a paper that I'm working on with Chris Bryman, who's a philosopher at William & Mary. And the argument goes like this. In the United States, at least, if a person is the victim of a procedural injustice within the legal system, or if they are actually innocent of committing a crime, then they are entitled in some jurisdictions to compensation for wrongful conviction and wrongful incarceration, because it's like really harmful to a person to be convicted and incarcerated. And so, their criminal record can be cleared. They might be given some kind of money as compensation for their lost wages while they were incarcerated. I think that the same reasons that we have this kind of standard of reparation for wrongful conviction are also reasons to support reparation for wrongful conviction under the drug war. Because the way that the drug war has been prosecuted has been procedurally unjust, both in the distribution of who's subject to these types of policing, but also just in the way that the laws were passed to be excessively burdensome on some groups and others. So thinking about the disparities between crack and cocaine historically. And also, I don't think that the standard of actual innocence should apply to actual innocence of a crime, because the moral basis of the criminal law is whether or not somebody did something that was morally wrong. I think actual innocence should be actual moral innocence, not just actual criminal innocence. And if we look at actual moral innocence, people who use drugs are morally innocent. So on the kind of same philosophical justification for why we would care about wrongful conviction and wrongful incarceration, we should also think that people who are convicted and incarcerated for drug crimes would have the same kinds of claims to being wrongfully treated by the state. So what should we do in that case? Well, I think that they're entitled to some kind of reparation. And there has been movements in places like Oakland, California, to provide a sort of reparation. So people who were convicted of marijuana crimes in Oakland had priority in having licenses to operate medical marijuana dispensaries in the city. And so reparation doesn't have to necessarily be like, oh, we'll give you some cash, but it could be giving people a sort of public recognition that they were treated wrongfully by the criminal justice system, and then some kinds of public benefits that seek to repair some of the harms. So it could be like job retraining, or it could just be a public apology or something. But I like this idea of I don't like licensing at all for this, but if we have licensing, given that we have licensing for the dispensaries, definitely give priority to the people who were treated so badly by the law.
Yeah, no, I think one thing you mentioned right there is very important too, is that, these reparations don't have to be, okay, here's a check, go away. Like you said, if 10 years of someone's life is stolen, let's say between the age of 25 and 35 because of a drug conviction, then, why is it outlandish to suggest, okay, maybe what the state in effect owes them at that point is, like you said, some job retraining, right? You would have otherwise been in the job market acquiring skills and knowledge if you had those 10 years rightfully in your possession. So once again, if you get out of jail, let's say at the age of 35 with no marketable skills, well, that's someone doing damage to you, right? So that needs to be rectified somehow.
Yes. So that's the idea, is that we should think about people who are the victims of the drug war as victims of unjust state intervention. And so just like other cases where the government should apologize and try to make good, I think that public officials owe a lot to people who are the victims of incarceration due to the drug war.
Well, our time is winded down here, and so I'm going to bring it around to the conclusion. And we usually like to conclude every episode in the following way, where we ask our guests to basically bring everything full circle and put a finer point on the discussion if we can. I know we talked about a lot, but here goes. If you were to put a finer point and a main takeaway from our discussion today, what would it be? What would you hope someone takes away from your discussion here with me today on whether or not all drugs should be legalized?
Public officials should not threaten people with violence and incarcerate them and lock them up and ruin their lives when those people are not doing anything that's morally wrong. It's not morally wrong to use drugs. And so public officials have no entitlement to be treating drug users the way that they do. Not only does it violate people's rights, it has disastrous consequences, both for recreational drug users and for patients. So none of the justifications for treating drug users this way succeed. We should reform the system to legalize all drugs.
Great. Jessica Flanigan, thank you very much for chatting with me on The Curious Task today.
Thanks so much. This was fun.
This episode of The Curious Task was produced by Alex Aragona and Sabine L. Chidiak. Our executive producer is Matt Buffton. The music you heard on today's episode was created by Lindy Voppenfjord. You should check out his other stuff online. The Curious Task exists today because of donations of time and money from those creating it and listeners like yourself. Check us out on Patreon and find out how you can support us and get access to exclusive offers. I'm Alex Aragona. Thank you very much for joining us on The Curious Task.